point of Magpas and the volunteer doctors is to try and provide that hospital level resuscitation room at the roadside, and that's what we've tried to do here. And that sort of starts the ball rolling very early, so a lot of what the hospital would expect to do now, we've already done.
My name's Claire Hayes-Bradley. I've been a volunteer doctor with Magpas for 3 or 4 years now. I joined them in the middle of my registrar training in anaesthetics, and I've been with them throughout that training, and I've now completed training in anaesthetics, intensive care, and the pre-hospital work that I do with Magpas. I'm also in the TA, and so some of my time I spend with Magpas, but also I have to fit in my commitments with the Territorial Army. I suppose I'd go back to the beginning when I joined. I was doing my registrar training, and a colleague, one of the other volunteers, Anne Booth, was talking about what she did with Magpas. And at the time I was becoming comfortable with my hospital job. I enjoy the challenge of the acute patients, or those patients where you don't yet know what's wrong with them, and you're part of trying to work out what's wrong with them while you're keeping alive. And I thought that this would be an interesting way to expand that from in-hospital practice and give me a little bit more of a challenge. And I think at the same time as well, I was also considering going abroad to do sort of charity work, and so the fact that Magpas was a full-time charity at that stage, or was a full-time charity job at that stage, sort of also appealed, because it was a way of maybe doing something for the community, but at the same time volunteering in a way that actually uses my skills and is useful to me, and something I find really interesting. And then I guess Magpas impressed me as a charity, the way they take themselves very seriously, the way they take their training and their clinical governance very seriously. They seemed sort of one of the obvious choice, really, to try and get involved. Ultimately, you've got a very unwell patient who needs urgent interventions to save their life, and wherever they are, whether they're wearing a military uniform or civilian clothes, and whether they've been brought into hospital, it's in essence the same patient needing the same interventions, but the choices about where or when you perform those interventions alter depending on the context you find yourself. So what you can do for somebody in a Chinook helicopter over the skies of Afghanistan is different to what you can provide to somebody at the roadside in Cambridge, or in the middle of a field in Norfolk, or sort of elsewhere. And so what's really interesting about work outside of the hospital is how the context changes it, and how whether it's raining might make a difference, you know, how cold it is, and where you are and what's happening. So the medical decisions become more interesting because of that context change. But does it utilise the same skills? Definitely.
Magpas is the East of England's award-winning medical emergency charity. With a range of partnerships with the NHS and police and other charities, it provides critical care paramedics and doctors to the roadside. We follow a day in the life of Medic 250.
We've got an air ambulance arrived with the air ambulance paramedics, who are obviously very good, very capable in this situation, very experienced at dealing with emergencies at the side of the road, and so we've split ourselves half and half, and they're taking charge of one patient there. I've been involved with giving pain relief, and they've taken over that role. With the second patient here, with Gary, we're using some stronger pain relief. We've been giving her some ketamine drug to get her out of the car. At the moment, there's nothing that we actually need doing right now, and a lot of pre-hospital medicine is deciding what needs to be done and when, and making sure that you get the right intervention at the right time. So looking at that casualty, there's nothing that I need to do right now over and above the extra painful that's being done. So I'm letting the guys that are doing this every day sort of get on and get the patient out of the car, and then we're going to bring her up on the stretcher, have another look at her, and hopefully that noise means that our taxi will be arriving shortly. We'll have another air ambulance to help us get her into hospital in the quickest route, get her to the big hospital as quickly as possible. So at the moment I'm really overseeing, checking with the guys, making sure we're happy on the priorities, on what's going on and what's happening, and really just standing back.
So Claire, why is it so important to have the critical care paramedics and doctors here at the roadside?
Well, you never know what injuries somebody's got, and you never know what life-threatening changes could occur between now, when we're seeing them and it's all very fresh and it's just happened, and maybe en route to hospital. So on the one hand, so far we're using pain-killing medicine that the ambulance service don't have, because The lady's got some very nasty broken bones that are sort of stuck in the car, and actually to get her out will be incredibly painful. And although you could get her out just with ambulance service medicines, it's a bit more humane to get a better pain relief. And there could be any series of events that could happen between now and the hospital, because we just don't know what's wrong with someone in terms of what internal injuries might be there until we actually get them to hospital. And there could be at any point between now, the crash happening, and getting them to hospital that she could deteriorate. And so part of having us here is for the potential to need to do extra things. Commonly that is extra pain relief, but beyond that, we've got some extra splints when she gets here that we're going to put on that the ambulance service don't have, which can reduce internal bleeding, and that will hopefully get her in a better shape when she arrives in hospital, because we can reduce the bleeding during the transit. Been handing over, and Gary's been giving a verbal handover of what's been happening to surgeons and emergency department doctors that are here, gathered here to look after her. We hand over, and unfortunately now I have the interesting job of the paperwork, just to make sure that we've fully documented everything that we've done, so that the care can be handed over properly and they know all the drugs that we've given.
So it really is a cohesive journey between roadside all the way through to...
Yeah, absolutely. I mean, we're starting with we're giving her sort of medical care or hospital standard of care from the roadside to here, and that's sort of the whole point of Magpas and the volunteer doctors, is to try and provide that hospital level resuscitation room at the roadside, and that's what we've tried to do here. And that sort of starts the ball rolling very early. So a lot of what the hospital would expect to do now, we've already done, and we've been able to get in as quickly as possible with things like antibiotics and strong painkillers. And so then documentation becomes very important, because this is the start of a hospital journey.